Good morning, everyone. Can you all hear me okay? Perfect. Thanks for being here. My name is Daniel Turenne, and today I'll be discussing the research I conducted on youth experiences of homelessness during my practicum at the Community Social Planning Council of Greater Victoria. So to begin, I'd like to recognize we're gathered here today on the traditional territories of the Lekwungen and Wasanich peoples, whose historical relationships with this land continue to today. I recognize as a student that I'm a guest here, and I'm grateful for the opportunity to work and live on this land. Quickly about myself, so as a white cisgendered heterosexual man without lived experience of homelessness, I recognize that the perspective I bring and the decisions I made in this research shape how youth experiences of homelessness are represented and interpreted. CSPC, the Community Social Planning Council, is a nonprofit organization based here in Victoria, dedicated to addressing ongoing and emerging social issues in the community. CSPC delivers a number of services and conducts research advocating for policy change in a number of areas. My time at CSPC was spent conducting research on youth experiences of homelessness in the region using data captured from the 2025 point-in-time count, which I'll speak to in just a moment. But before we jump into my research, I just wanted to provide a brief overview of the state of youth homelessness in Canada. So across Canada, an estimated 40,000 youth experience homelessness each year. The majority of interventions to date are focused on chronic experiences of homelessness with an emphasis on emergency services, which are often designed to serve adults and don't consider the unique needs of youth. To make progress towards ending homelessness in Canada, we must place focus on preventing youth experiences, as such experiences can lead to folks becoming entrenched in homelessness and experiencing housing insecurity throughout the course of their lives. Not only do these experiences lead to and sustain experiences of homelessness, but they have a direct negative impact on the health of people over their lifetime. So in 2025, prior to my practicum, CSPC conducted the point-in-time count, which is a federally mandated data collection method aimed at capturing visible experiences of homelessness. PIT counts are the main way of collecting data on homelessness in Canada, and they have two components: the enumeration, which is a count, and the homeless needs survey, which provides more detailed information on how homelessness is experienced. And so today we'll be focusing on the homeless needs survey component, as my report was concerned with understanding youth experiences of homelessness. So overall, the survey found that among individuals experiencing homelessness in Greater Victoria, Indigenous and 2S LGBTQIA+ youth, or population, have a higher representation among youth compared to the general survey population. So specifically, a stated goal of the Homeless Needs Survey, so as stated by the federal government, is to provide data to better understand pathways into homelessness in order to strengthen prevention services in those areas. So I was tasked with using data from the Homeless Needs Survey to meet this goal. So as a part of my practicum, I undertook a youth-focused analysis of the survey data, analyzing how Indigenous identity, 2S LGBTQI+ status, and gender identity shape experiences in Greater Victoria, with a focus on how pathways into homelessness and service use differ among youth. So as I worked through the literature, I quickly began to understand the limitations of the point-in-time count method. Being a cross-sectional method, it provides a snapshot of homelessness rather than a picture capturing the sequence of events and the structural conditions that precede housing loss. And this limits the ability to actually understand pathways in the first place. So while PIT counts are valuable for tracking trends and building political will, they're limited in that they only capture visible experiences of homelessness. This matters because homelessness isn't just sleeping outside or in a shelter. Youth experiencing homelessness are particularly susceptible to hidden homelessness, which means couch surfing, staying in unsafe situations, or deliberately avoiding services. Point-in-time counts systematically undercount hidden homelessness, which results in the picture overrepresenting the most chronic and entrenched experiences, while the more fluid and hidden experiences of homelessness common among youth go uncaptured. So these limitations resulted in the 2025 point-in-time count having a very small sample size of only 69 youth, which is definitely an undercount. Given this sample size and the cross-sectional nature of this data, the findings of my research can really only highlight patterns within the sample rather than establishing causal relationships that are more generalizable. So the methodological limitations of point-in-time counts are even greater when attempting to conduct an intersectional analysis. The literature identifies intersectionality as essential to understanding how race, gender, sexuality, and other dimensions interact to shape youth experiences of homelessness. While this report attempts to examine differences in youth experiences of homelessness across identity groups, the small sample size constrains the ability to do so. So for example, due to the small number of gender diverse youth who were captured by the data, their results were actually excluded from the analysis in order to protect their privacy, which has resulted in this group being rendered invisible in the results and recommendations drawn from point-in-time counts. The limited sample size also restricts the ability to examine experiences at the intersection of multiple identities simultaneously. So for example, examining experiences of Indigenous 2S LGBTQIA+ youth, a group whose marginalization is apparent in the literature, was not possible with the current data set without risking identification of individuals and violating their privacy. So as a result, this report analyzes identity categories independently, which limits the understanding of how intersecting identities shape risk and need. So these limitations cause critics of point-in-time counts to question whether the focus on these counts as a policy tool is worth the time and funding required. It can be argued that the resources spent on these counts could go further if invested in research that can trace pathways into homelessness over time. So this isn't to suggest that point-in-time counts don't have any value. They provide important data that can draw attention to the scale of homelessness, creating both public and political will for action. However, these counts should be a starting point that are complemented by richer, qualitative, and individual-centered approaches, capturing the complexity and diversity of youth experiences of homelessness. So as a result of these critiques, this research uses point-in-time count data to provide a starting point. So I'll share some findings that are consistent with the broader regional and national research, offering insight into how systems are being experienced locally by youth in the sample. Regarding early experiences of homelessness, the most striking finding was that 76% of Indigenous youth first experienced homelessness before the age of 18, compared to 57% of non-Indigenous youth. So related to this, almost half of youth in the sample reported foster care involvement, with the majority finding that the system was unhelpful in transitioning them to adulthood, with these findings being higher among Indigenous youth. These findings reflect a well-documented pattern that Indigenous youth are both overrepresented and underserved in the child welfare system, and this cannot be understood without acknowledging the enduring legacy of colonialism shaping these outcomes. These findings indicate that there may be systemic failures that have contributed to early experiences of homelessness among youth in this sample. So considering service needs, Indigenous youth reported a higher need for mental health and harm reduction services compared to non-Indigenous youth. And notably, 2S LGBTQIA+ youth reported higher levels of service needs compared to not 2S LGBTQIA+ youth across several domains. This finding highlights the need for adequately tailored services for youth, as youth with different identities have varying service needs. So in looking what this points to for future research, the small sample size of youth captured by the point-in-time count demonstrates the need to improve its reach to better capture experiences. The Canadian Observatory on Homelessness has actually developed a point-in-time count toolkit module aimed at improving PIT counts by partnering with schools and expanding the scope to include hidden homelessness. So further to this, incorporating youth with lived experience in the design and promotion of the count would also strengthen these efforts and work to ensure that outreach methods and survey questions are reflective of the perspectives of the youth that the point-in-time count is trying to reach. So beyond improving what PIT counts can capture, the patterns observed in this report regarding how Indigenous identity, 2S LGBTQIA+ status, and gender identity impact youth experiences of homelessness indicate that there's value in research that goes beyond cross-sectional counts to understand not only what factors lead to experiences of homelessness, but why such factors result in experiences of homelessness. So qualitative interviews conducted by trained and culturally competent researchers in safe and private settings could offer opportunities for disclosure that the PIT count cannot. And this research should be carried out through a community-based participatory approach that centers youth with lived experience of homelessness as co-researchers driving the questions asked and the interpretations of findings. So addressing the cross-sectional limitations more directly would require longitudinal research designs that track youth trajectories over times. And in the absence of resources for such work, administrative data linkage using the Homeless Individuals and Families Information System could offer retrospective insight to pathways at a relatively low cost. So in closing, I'd like to thank CSPC, specifically Dr. Shelley Cooper and my colleague Jenna Ustek for their support throughout this work, as well as Jeff Masuda for his insight and feedback on my work throughout the practicum. So thank you all for your time today.